Hi, my name is Meng. I'm Program Director of Radiology and Nuclear Medicine at Alfred Health and a Professor of Radiology at Monash University, also in the Department of Neuroscience and Electrical Engineering. I'm also Director of the Eye-Brain Research Lab at Monash University, and one of the diseases that we're studying is brain tumors. And you would think that brain tumors is a reasonably rare disease, partly because there are challenges with making the diagnosis.
And I would say the most challenging part in regards to diagnosis of glioblastoma or brain cancer is the fact that glioblastoma presents quite late in terms of the actual disease presentation. So generally, when the diagnosis happens, the disease is already quite well established, and that creates a challenge for the patient, a challenge for the clinicians as well. What's the most challenging part about studying glioblastoma? I would say the most challenging aspect of it is the fact that it's such an aggressive condition and that there's not much available in regards to treatments. One of the most exciting aspects of our work is that we have been able to identify a particular protein being involved in glioblastoma or cancer cell proliferation, and we're trying to understand how we could block this protein and to see if that can actually reduce tumor cell number. So this is quite exciting, but of course, we do need to do more to understand the disease in a much more rigorous manner and to hopefully develop treatments in the future.
Some of the more positive aspects of our research and research in neuroscience in particular is the application of artificial intelligence. So, it's difficult for a human physician or clinician to incorporate so much data from either imaging or pathology or genomics into try and figure out what might be not only the most optimal diagnosis, but then the most optimal treatment for a patient. And I think that because there's so many data points and so many elements involved with that now, incorporating artificial intelligence to try and analyze all this data, I think is a very positive step in research into rare disease and particularly brain tumors. So that now we're developing some algorithms and some models in using artificial intelligence to analyze a lot of this data, and then we can provide perhaps a more accurate diagnosis and also propose the most optimal treatment. And this will include potentially looking at the numerous clinical trials that are out there in the research environment, as well as providing the most optimal surgery, chemotherapy, and radiation for brain tumors. So I think that's a very positive step in the research that we're doing, and also the research into rare diseases and brain tumors in particular.